All right. Good Monday morning. I am so excited to introduce you to one of my friends. Her name's Kristen. She works here at Core Wellness. Well, this is your company.
It is.
Yes. Actually, you tell about your company.
Yeah. So it's called Core Wellness and Physical Therapy, and it's in Milford, Ohio. Which
is where we are right now.
Yeah.
It's awesome and close. I got here no problem.
Good. So it's an outpatient orthopedic clinic, but really the specialty is women's health. We've been here for about 2.5 years, do a lot of manual therapy, myofascial release, some dry needling stuff, craniosacral. Really what led me into doing this is so I've got 4 little kids of my own who you have met.
4. You are a rock star.
Well,
and she's working and looks like
fun
this
and crazy
beautiful
all at the same time. And so I think what led me into doing some of this women's health stuff is that, all my pregnancies were pretty normal, really uncomplicated, but, I had 4 pregnancies, 4 deliveries, 4 postpartum recoveries, and it's, all of those are hard in themselves, and
yes.
I'm thinking, a lot of times thinking back, like, goodness, like, I know what to do, and it's still hard. I can't imagine, people have babies all the time, and then they're just expected to go back into it. So I think that's what drove me to the passion for wanting to help women who are trying to get pregnant or are pregnant or postpartum.
Right.
So that's kind of what led me into this. And even, funny story. So after my third little one was born, I don't run during pregnancies, not that you can't, but I just personally just don't feel comfortable. I feel like a big oaf as I'm trying to go.
Comfy.
Right.
Yeah.
But so I was 2.5 weeks postpartum. And I'm like, I'm going to take a run. It's June. I haven't been running for 9 months. I'm doing this. And I know better. I knew that I wasn't ready, and I knew. And so I go out and I run, not very long, and I might hurt my knee.
Of course.
And it took me a whole year to recover back to the point that I could run downhill.
Yes.
And I knew better.
Like, why did I do that?
I knew better. You know what I mean? And so it's like that thing where it's like, even if you have the information, it's still sometimes like needing that accountability for what you do and being able to help that as well.
Yes. So. Well, and she was saying what led her to her profession, what led me through her doors today is this talk on pelvic floor therapy. Yes. And I'm telling you, this topic keeps popping up, and I got a message from you on Messenger just kind of like describing exactly what she's been hearing lately. And I instantly was like, can I please come interview you? Can I please come do this chat together? Because you are about to blow everyone's mind.
Yeah.
I'm serious on your knowledge on this and just introduce it to the world.
Yeah.
So one of the first things that I wanted to talk about, because I think what we women go, oh, it's normal that I pee when I sneeze.
Yeah,
or I'm like immature. I laugh when I talk about this.
Well, and I think that's part of the misconception too, is like down there. Like, talking about that. No one wants to talk about what's going on down there.
Right.
Another part of our body.
So you're saying it's not normal to pee when we sneeze, not normal to pee when we jump
And so not normal. It is not normal, no matter what age you are, no matter if you've had a baby, whether you have not, it is not normal to pee yourself or have to wear a pad. But,
do you hear that? Not normal.
You see on bathroom stalls all the time, these, pads. Wear these pads when you exercise, because then you will be able to, protect yourself if you leak.
Sure.
But really, why do you leak? Well, it's usually your pelvic floor is weak, or most of the times it's really tight. So Kegels aren't going to solve it.
That's what I feel like you always hear, though. More Kegels.
Just strengthen. But most of the times you're tight in a lot of different ways, and you need to loosen that before then you can retrain it of what to do.
So I think what's important as we continue to talk right now, though, like, what are you doing? What is pelvic floor therapy? Because I feel like a lot of people don't know. Yeah. So how does one release, like everything you just said, what does that entail?
Well, so one of the things we do is called myofascial release. And so it's basically you put your hands on and you wait for the release to happen. Same thing externally as what pelvic floor health is. We'll look at the external health, but then you'll look at the internal health, intravaginally, interrectally, maybe even too, and see, gosh, what does that look like? Is it tight? And at first it's like, whoa, you're going there. What's that mean?
I'm not doing it. Yeah.
But think about it. I mean, if you've been pregnant and had a baby, something came out of your pelvic floor.
Yes.
So you can't expect that pelvic floor just to go back to where it is. So there need to be releases inside, and there needs to be retraining. If you had an episiotomy, if you had a C-section even, I know that wasn't a vaginal birth, but that needs to be released too.
Right.
So that you can run, you can jump, you cannot have to go to the bathroom every
time that you set out to go. Yes.
Exactly.
Okay,
Right.
so let's say somebody was listening and going, oh, I can't fathom that, but I could like start to consider it because I'm so sick of having my symptoms.
Right.
What does a therapy routine look like with that? Like how often would they be coming to you? And
it really just depends. I mean, and even too, there's people that say, you know what, you're not going down there. We can do a lot of stuff externally also. So it doesn't have to be, it can be as invasive or not as invasive as, you know, what the comfort level is. But a lot of times it's maybe once a week, maybe every other week, maybe every 3 weeks, depending on where they're at. And how my clinic works is we'll do the work here, the manual work, and then I'll give you exercises to do and say, here's 1 or 2 or 3 exercises that homework. You can do.
Yes.
Yeah, and things to think about, lots of education of how do I breathe correctly? How does my pelvic floor get influenced with lifting a baby or running or cleaning my house? How does that all fit into it? So a lot of education so you can feel empowered, like, oh, that makes sense.
Right. Absolutely.
Yeah.
Oh, I love it. Okay, so that's one thing, the whole urinating issue.
Yeah.
1. 2, can we bring up the plantar fasciitis?
You talked about that.
I did. Okay, you're going to go, why are you talking about plantar fasciitis? I was running with a doula at our triathlon that I was doing the last weekend, and she was telling me that pelvic floor therapy can really help with the healing of plantar fasciitis. Tell us more. I don't get this.
And so, yeah, that seems, you know, okay, it's my pelvis, it's not my foot, or it's my shoulder, it's not my pelvis, whatever. But really, if you have any type of injury anywhere in your body, it can affect something else. I think very, very, very rarely have I ever seen plantar fasciitis that's not coming from up the chain somewhere. Almost always it is. It's rarely in isolation down at your foot.
Okay.
So when I think of the core, I think of your pelvic floor, your stomach, your back, and really your shoulder blades too. If something that core area is not working correctly, something's going to give.
Okay.
And for you, it just so happened to be your foot.
Yeah.
Right? Or maybe
well,
it wasn't
I
yours,
don't feel like, I don't necessarily struggle very much, but I feel like it's a constant conversation. Don't you think plantar fasciitis?
Well, or knee pain, or low back pain, or neck pain, or, I mean, you could put anything you want to, and you know, for foot pain, and it could be just about any of that.
Right.
And oftentimes it's, well, okay, let's talk about where are things at. Are you strong here? Can you control doing these exercises? What does that look like? And if not, let's address the core problem, and that'll help a lot of the secondary problems that go along with it too.
Right, which makes me feel like we have to talk about the whole concept. I think that people sometimes pass over physical therapy. Like they go, I have knee pain, I have foot pain, I'm going straight to the foot doctor, I'm going straight to ortho. And I feel like after knowing you and your specialties, there are so many people, I'm like, start physical therapy, you know, start here. See if you can get your reprieve far before you start looking elsewhere.
Well, and then I think, too, it's something where I think what I've heard is some misconceptions is that you have to be in a car accident, or you have to have surgery, or you have to have something big to then get into physical therapy. And if not, like, well, they don't really care if I have a little foot pain or a little knee pain or my hip hurts a little bit when I run. Right. That's exactly what I want to see
You want, like, almost more the preventative side.
So that it doesn't turn into surgery or something like that, that we can stop it before it gets to the point where it's just out of control, too.
Right.
So, yeah, I mean, I think, too, you know, what I'm doing or what physical therapists are doing, they're trying to get things without medicines, without, you know, like I said, surgery, or without those big things, and we can get it and then really get you back to life is really what the goal is.
Right.
Whether that means picking up your baby or running or just sitting in your office and being able to not have pain when you're hanging out or doing your work.
Right. So that's huge. Okay. And I'm going to keep going because there's another that I feel like women after babies talk about all the time. And I'm not going to say the name because I keep butchering it. And I even had to look it up. And after I looked it up, I'm like, I totally know what that is. So I feel like, let's say the real medical name, and then I'll call it what I would call it.
Diastasis recti, or DR.
Or I would call it splitting of your abs. It's when women talk about their abs ripping during childbirth. And so you're saying...
Well, and so it's not even just, I mean, so there could be some of this ripping, but it could just be, you know, normal. We carry babies, or even I see this a lot with weightlifters, or some people that maybe, you know, work out a lot, or even overweight too, where their abs just can't control what they're asking them to do.
Right.
And so that typical 6-pack then opens up a little bit, and you've got this big opening in the middle.
Recti.
Diastasis recti.
Diastasis recti.
And why the medical term is because I feel like it gets thrown out a lot. People, do I have it? Do I not have it? What does that mean? Does that mean surgery? What do I do about it?
Right.
Well, and that's an essential part of your core. If we don't get that figured out, and there's lots of ways to get that to come back together again.
Right.
Not hard ways. I mean, easy ways to get that to come back in, but that usually fits in with what the pelvic floor is doing also, and getting those two to work together so that you can have that strong foundation. Mm-hmm. So it's a hot topic. I mean, you'll see it at a lot of different places, but it's not a scary thing, and it's not a thing that can't be treated.
Right. Well, I feel like for as many things as we just touched on that it does cover, it's kind of crazy that it's not. Like, why do you think it's not a more well-known topic?
I think anything. You mean pelvic floor stuff?
Yeah, let's just keep with the pelvic floor. We'll stay in that line. But
just in general, I mean, I think women have so much on their plates. Everybody has so much on their plates, but especially with kids. I mean, you've got your kids doing their stuff. You're trying to, if you work, you're trying to take care of the house. You're trying to be a good wife. You're trying to be a good friend. You've got all these things going on that very often we're last. We don't take care of ourselves a whole lot. So I think that's a big part of it is that, well, I have a little bit of this, but it's okay.
Right. And it kind of feels like preventative treatment versus necessary.
Yeah. And it's like, well, I can live with this. I'll just do this and I'll be fine. And I think too, a lot of, some health practitioners too don't even know that this exists. So it's like, well, I'm sorry that you're having pain or that you're having leakage or your abdominals are open, but that's just normal. That's part of pregnancy. That's part of life. You're getting older. Just kind of deal with it a little bit. And so I don't think the resources are there to necessarily know that it exists.
Well, we were talking before we sat down and how you were saying somebody who has been in the profession for 10 years did not know that Kristen existed down the street doing
or even know that any therapy like this existed. She was so excited that, now I can have somebody to refer my patients to because all I knew to do was to give them medicines. And this was a healthcare professional out for 10 years that sees women that have had babies and so it was pretty eye-opening.
So, topics that just feel like second nature sometimes because you're talking about it every day. There are people who have I was just talking to my neighbor this morning and saying that this interview was going to happen today and about pelvic floor therapy. And she goes, oh, yeah, Kegels, going that direction. I'm like, no, it's like an internal therapy. She goes jaw drop, what?
Yeah.
So that's somebody too. She's health-oriented and I feel like
Well, and even too, like you said with the Kegels, we already talked about this, but I think, we'll just do Kegels and you'll be fine.
Right.
Okay. And then I had a woman who told me, I got to get my husband on board for this, or I don't know that my husband's going to be okay, or I don't know that I have time, or I don't know that. And there's all these, things that come up. And it's, again, let's put myself last because for whatever reason, and I think that's a huge part of it as well.
Well, I always feel like ask yourself the barriers. What is stopping me from walking through the doors? Because I think you're so comfortable that you could break down a lot of those barriers.
Yeah.
Or at least walk someone through it. And a visit doesn't mean that you're committing to years together,
absolutely.
right?
I mean, it could be a couple visits. It could be an extended. It really depends what your needs are and what your wants are. And I always don't want people to shy away either from coming in because they think, well, I don't want her to do that. That seems so, and is it awkward? What is it like? And so don't let that be a hold up because that doesn't have to happen either.
Right.
I mean, just getting help and having education about it could be just as helpful as doing any of the manual work too.
Sure.
Yeah.
And since we have you in here, just physical therapy in general, because I feel like I have so many clients who have past injuries. It's almost like if the injury's so far gone, people forget that physical therapy exists still for that injury.
Yeah. Right.
That, tell me that too. Are they needing doctor's referrals to get back into you? How does that look? Because I think a lot of people get held up on the process. The process is, do I have to get a referral? And then I have to, it seems, and that's enough to be like, I'm not doing anything.
Right. Well, no, I mean, you can just walk in and we can treat you. I mean, you don't need a doctor's referral. You don't need to have seen any physician. It could be an injury that happened 10 years ago. maybe I'll just treat this now. Or it could have just happened 2 days ago. And then you
Mhm.
can do therapy for that pretty effectively, really. I mean, there's a lot of things that can be done, just the run-of-the-mill injuries with it. So it's it really can be a pretty easy process. And how we do it is we'll evaluate you and then get treatment in the same day, too, and give you an idea of, hey, here's what needs to happen, and maybe here's the next appointment, or you know what, let's just kind of wait and see what things look like at that point, too. So like you said, you're not signing up for extended, I have to do
months
this
worth
for
of therapy,
weeks and weeks.
taking off work every day. You know, it can fit your schedule. You have Saturday hours.
I do, right?
Which is amazing. Or evening. Yeah, I'm serious. I think that's another big holdup that people go, I can't take off work to go do that. It's a luxury that, like you're saying, not all women provide ourselves. So and men too, if you're listening.
Right, and I don't mean to pigeonhole women, because we see a lot of men, and there's a lot of issues that will come up. And even, a lot of just general orthopedic, it's, well, what's your main problem? Well, my main problem is I'm at work and all I do is sit at work for 40 hours a week, but my neck hurts. Why does my neck hurt? I'm not doing anything. Well, that's a huge another conversation too. Right. That inactivity is just as much as too much activity. So we see a lot of, we don't have to suffer if your neck's hurting, because usually there's things that you can do posture-wise. We do a lot with posture to get things back into where they need to be as well.
Mm-hmm. Okay, so just as we're wrapping up here, though, so you are here in Milford.
Yes.
You can walk through your doors. You don't have to make an appointment.
Make an appointment, but I'm saying like you could be injured and call right away and we can get you in. That's what I meant by that.
Okay.
You could try if you could walk in and get right in, great. I can't guarantee that's probably going to happen. Right. But yes, call and make an appointment, and that would probably be the way to go.
Okay. Well, and that happened to my neighbor when she hurt her knee. She was in so much pain she could barely walk. Kristen squeezed her in. Remember? I think he did dry needling.
Yeah.
And she was almost 100%. I mean, she came back going, she's a miracle worker. This is amazing. So you're like an on-demand too, as far as like instant relief on some things. I know it's not a promise of everything, but like.
Well, and the biggest thing we'll do is like, if there's something immediately in pain, sure, we'll get that calmed down. But then the big thing is looking at the whole picture.
Right.
Well, holistically, what do you look like? And why I started my own clinic is I wanted to see patients one-on-one, and I wanted to see them for a whole hour, and I wanted to make sure that happened versus trying to like squeeze in, and I see you and I see you, and you're all here at the same time, and I don't have time to do this. I wanted to make sure
you're like one-on-one focused.
Right. Yeah. And I think that's been huge to be able to help and get people their immediate, let's get that calmed down, but then let's also make sure it doesn't come back, and let's make sure you're doing the right stuff to be able to continue to live what you want to do.
Right. Yeah. No, the whole picture, and I love that. I'm going to post all of Kristen's information when we are done with this. It will be below. Yes. Thanks. So if people do have questions or want to make an appointment, please do that. Yeah. And just thank you. I drove over, and you're in between clients right now. I was like, can we just do this really fast?
Yeah, thank you all so much. I appreciate it. And I think the biggest thing is just getting the information that there is stuff available to be able to help people.
Yes.
And
you're tangible. Like, I sometimes just feel like, again, back to the referral thing, sometimes therapists don't feel tangible. And you're all you have to do is call. Like, it's
we get
not
people
a process.
To call and ask questions. Like, if you're not sure, ask questions. And, we'll fill you in the best we can. So
did you have an email through your system too? So you could possibly email?
Right.
Yep.
Yes. There's all kinds of stuff. Thank you. This was great. I appreciate it.
Okay. Well, you did it. We were a little apprehensive.
We're finished. Yay! This girl's great. Check out her book too. I mean, Direction, Not Perfection. I love it. She just gave one. I can't wait to read it. So, yeah.
Yes. All right. Thank you.
You're welcome.
You're the best.
All right.
We will see you next Monday. Bye.